Hi guys, hello and welcome to this new segment. It's called Inside Coffee, where we'll be speaking to experts on current trends or current news topics. Okay, do stay tuned. I can see about 9 people have joined us right now. For today's topic, today is the first segment. For today's topic, we'll basically be talking about safety on a plastic surgery. All right. We have with us right here, Dr. Oh, sorry, hang on. Let me remove the banner. We have with us Dr. Muya and Dr. Marzida. The Dr. Muya is a plastic surgeon currently working in PPUKM and is a committee member of the association called Malaysia Society Plastic and Reconstructive Surgery, or MSPRS. We also have Dr. Marzida, who is also a plastic surgeon currently working in Glen Eagles Medical Center, who is also a committee member of MSPRS, and both of them obtained their certificate in Master of Plastic Surgery from University of Science Malaysia. So, hi, Dr. Muya, Dr. Marzida. Thank you for joining us.
Hi, thank you for inviting us.
Yes, okay, it's good to have you guys on the show. Now, for the benefit of our viewers, I'm sure most of them have not really heard of MSPRS before, the Malaysia Society of Plastic and Reconstructive Surgery. Perhaps you can share and let the public know who is MSPRS and what do you guys actually do.
Alright, MSPRS, short for Malaysian Society of Plastic and Reconstructive Surgery, is the National Association of Plastic Surgeons in Malaysia. Our members are practicing plastic surgeons in both government and private, and the association acts as a platform for us to share our thoughts, our knowledge among members, and also to disseminate our to disseminate knowledge about plastic reconstructive and aesthetic surgery in general public. So we are formed in 2010, and currently we have about 57 plastic surgeons who are currently working in both government and private sectors.
Oh, okay. 57, quite a lot also, actually. It's quite a lot. I always thought like plastic surgery is still taboo in Malaysia. So it never come across my mind that many people are actually into it. So it's interesting to know. It's interesting to know. Okay, I'm going to share an article with you guys, right? I'm going to share an article so that we can comment and see what you guys think about it. Okay, this article is taken from the Star. So, model's death after botched liposuction highlights risk of going to dubious salons. It was in the news not too long ago. Basically, this Coco Siu, age 23, went for a arm liposuction surgery and did not come out with her life. This has basically brought up a lot of concerns about how are these being regulated. I think probably for a lot of people also it's the first time knowing about these people are unlicensed to do certain surgeries and whatnot. Maybe you can share with us what are your views regarding this article. Maybe we can start with Dr. Muya.
Alright, I've read the article before. First of all, my condolences to the family and her loved ones in mentioning the article. It was such an unfortunate event, and I'm sure we are all saddened by it. However, regarding the case of it, I can't comment too much because this case is still under investigation. But from what is written in the article, the procedure is stated to be done in a beauty salon. However, I read in that article, there's a statement from the deceased friend. She or he be referring or assuming that this beauty salon as a clinic. So I can see it seems to be a misguided assumption of the type of premise. And in regards to the liposuction procedure itself, this kind of procedure must be done by a qualified medical practitioner. And not only by a medical practitioner, it must also be done in a licensed medical premise. So from the article, it is done in a unlicensed premise and it is done by an unqualified medical personnel, which is a doctor. I think it is quite alarming news because there is a blatant misconduct here, and this is against the law, and we need to highlight this.
Okay.
That-
Okay. 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 Dr. Marzida, why do you think this happened, and what threat does it pose to our society?
Okay. First and foremost, yeah, deepest condolences to the family and friends of the deceased. Actually, I am not in position to speculate on why this incident actually happened and how it is causing a threat to the public society because, like I said, it is still under investigation. But probably the better way here is to highlight what we can learn from this, and how do we go about learning, and who should we turn to if you want to go for a surgical procedure like this, and why do we need to know all this? Again, it all boils down to the health and safety reasons. Basically, I think we want to make Malaysia we want to make plastic surgery in Malaysia as safe as possible. So together we must move forward, and we must create that sort of new culture to inculcate a correct culture so that people who seek for cosmetic and aesthetic surgery can do, right?
Okay. Okay. Just to understand a little bit better, the arm liposuction process that the COCOSU enrolled in, maybe you can help run us through what entails that particular surgical procedure, Dr. Muya.
Okay. An arm liposuction is a cosmetic procedure, as we know, whereby the fat is being removed in a certain area. It can be, this arm is from the arm, it is from the tummy, then from the tummy, and the liposuction. It is being removed using a machine called liposuction machine or a liposuction instrument, depending on the volume that needs to be removed. This type of procedure is an invasive surgical procedure. So it needs to be done under general anesthesia or a local anesthesia so that the patient won't feel any pain. Before the procedure of liposuction itself, we will infiltrate a fluid called tumescent. Tumescent is a cocktail of fluid which consists of saline water, anesthetic agent, and also an agent that constricts the blood vessel. So why do we use this is they act as a painkillers and also to reduce the bleeding during the surgery and also after the surgery. So as we can see, there are two components of the procedure. The first one is the tumescent infiltration, and number two is the liposuction procedure itself. And all components carry its own risks and benefits, and both are invasive procedures.
Okay. Okay. Now, I understand that not all licensed doctors are the same. Am I right?
Yeah.
Why is that so?
First of all, let me emphasize that there are so many aesthetic and cosmetic procedures that are being offered out there. Some are offered by beauticians in beauty salon. Some are offered by general practitioners in aesthetic, with aesthetic training. Sometimes we call them aestheticians. Some are done by medical specialists, mostly dermatologists, and some are done by plastic surgeons. These are surgical specialists. And the procedures are generally divided into non-invasive, minimally invasive, and invasive. So, for example, a beauty salon are allowed to offer non-invasive procedures like a facial, spa, except for procedures that are using machines and medication in the form of treatment solutions or medical devices, because they fall under Medical Devices Act. For example, intense pulse therapy, microdermabrasion, and also chemical peel. These procedures need to be done by a licensed doctor. And for minimally and invasive procedures, they can only be done by doctors, by licensed practitioners. I would also like to emphasize that not all licensed doctors are credentialed or allowed to do aesthetic and cosmetic procedures. Only those with a proper training are allowed to do it. And even so, the training level differs from a general practitioner with aesthetic training, a medical specialist such as dermatologists, and as well as surgical specialists such as plastic surgeons. So that is why there are types of aesthetic procedures. Some must be done by licensed practitioners in licensed medical firms.
Okay. So basically, there are several different levels of practices or surgery, right? And in these different levels, there are some which require license and some that does not require licenses, and that comes down to how invasive the process is, correct? And then even for licensed practitioners, there are also several different levels or different types of doctors, right? Okay, so maybe you can share what are these different levels of the doctors, Dr. Marzida?
Oh, okay. A person who call themselves doctors must firstly registered and qualified under the Medical Act 1971, and they must be recognized by Malaysian Medical Council. That's the first and foremost. So if we zoom into aesthetic practitioners, then we need to refer to the guidelines on aesthetic medical practice. Okay, so there are basically three doctors that can perform. Number one are the general practitioners. Number two are the medical specialists, whether core or not. The core would be somebody like a dermatologist, a skin specialist. And number three, surgical specialists. The core doctors in this category would be the plastic surgeons. And of course, non-core means those who wants to do aesthetic, like probably an ENT surgeon or a breast surgeon and whatnot. So, and in this guideline also, it tells us this category of doctors can only do a certain category of procedures depending on the level of invasiveness, just like Dr. Muya mentioned just now, whether it's non-invasive, minimally invasive, or invasive. You can search more in this guideline. So when these three categories of doctors, if they want to practice cosmetic medicine, they need to go through application, and various requirements are needed, and if they are successful, they will be awarded a license. When you call it an LCP, Letter of Credentialing and Privileging, and within this LCP, it's not the same. You have LCP Chapter 1, and these are for GPs. LCP Chapter 2, which will be awarded to a successful medical specialist, and LCP Chapter 3, which are awarded for surgeons, basically plastic surgeons as core. So whatever LCP Chapter 1 holder can do and LCP Chapter 2 holder can do differs. So you can check again the guidelines and to see. And of course, when you look and zoom in into liposuction, then of course only LCP Chapter 3 holder, which are the only plastic surgeons, can perform such procedure in Malaysia. Okay, but of course, having said so, some non-core medical specialists who would want to do liposuction, they have to go through various processes, and they can get privilege based on case-to-case basis only in Malaysia.
Okay.
Does that answer the question?
Okay. Yeah. Quite detailed, my. Okay. Very good.
Okay.
Yeah. So okay. There are basically, there is also aestheticians, correct? Aestheticians, people who handle aesthetics.
Yes. Yep.
They are not the same as plastic surgeons.
Yes, they are not.
Yeah, but are there any procedures that that they can do that plastic surgeons also do?
Yeah, like I said, when we talk about LCP Chapter 1, 2, 3 holders, the aestheticians, which are usually the general practitioners, they are only allowed to do non-invasive and minimally invasive procedures. Those are like dermabrasion, chemical peels, injections like Botox, and injections like fillers. But for example, like if it's a Chapter 3 holder, LCP, we are able to do the whole spectrum. If we are licensed to do, that means we are able to do the whole spectrum of the aesthetic procedures, include the non-invasive, minimally invasive, and also surgical. So because there's usually some confusion, people in public thinking that, look, plastic surgeons only do surgery and not the minimally and non-invasive part.
Oh, okay.
Yeah.
Okay. Good to know. Okay. Back to Dr. Muya. Okay. So, how can the public know if an establishment has license to practice or not? How do we tell?
There are two types of establishment, the private sectors and the government sectors. So I'm from a government sector, and
Okay.
I will tell you in Pambit as a government servant. A government hospital and clinic establishment, we may be easily recognized by the public, but in private practices, especially in a small non-hospital based establishments, then it can be quite tricky. So, but we live in a world where information is right on our fingertips. We can Google, and there are actually legit website links and registry provided by our Ministry of Health, listing all licensed clinics, credentialed aestheticians, dermatologists, and plastic surgeons. You can find, for example, doctors in Merits MMC, our Malaysian Medical Council website, whether they are registered doctors or not. You can find licensed doctors who are allowed to offer medical aesthetic services in Malaysia at registered medical practitioner for aesthetic practices list of registry, which is available at the Ministry of Health website. Finally, you can also find a list of specialists at our National Specialist Registry website. Of course, you can also check our society website, www.msprs.org.my, to see credentialed plastic surgeons under our association.
Okay. Dr. Marzida,
Yes.
what would be the benefits of a licensed practice versus, say, the risk of an unlicensed practice?
I think we need to value the licensed practice because they are well regulated by MMC, by Ministry of Health, and we need to realize that safety and beauty come together. Okay, safety comes first, and is always dedicated to best practice, patient care, backed by education and evidence-based medicine. Because we need to understand, even at the best hand of doctors and plastic surgeons, sometimes complication, a fatal one, can still randomly happen. So at least if you go to someone who is licensed, who is credited to do the surgery, and at a safe place, accredited, established minor surgical room, daycare center, and hospital, then it gives you that you are in a good hands if something bad were to happen. Okay, and when you talk about unlicensed practice, I don't see any pros in that. You are taking a very big risk. In fact, it's all about safety again. The worst scenario is your life. And of course, it's difficult sometimes to track this unlicensed people because there are some unlicensed which stay put at one place, but some they hop to one place to another, and that's very difficult. They go from clinics to houses and even hotels. So I guess it's just not worth it, no matter how appealing the marketing is or how cheap you think it would be. So I guess it takes two ends. The giving end, which is the practicing practitioner, and then of course the receiving end, the public who seek beauty treatment. So you got to do, both sides have to play a role in that.
Okay, understand. Basically, we should all just go for a license.
Yes,
plastic surgeon lah,
definitely.
right? Definitely.
Definitely. A licensed practitioner, licensed doctors.
Yeah, because everyone's well trained, everyone knows what to do in case of an emergency. They know what to do, as opposed to
Definitely.
a licensed one, whereby mishaps can happen because these are things that they probably learn from their auntie, uncle, or maybe passed down for generations. I still don't know, but again, if they're not doctors, then when you actually get a medical emergency, they may not know what to do, and there's no amount of money that's worth gambling your life for, lah. Basically, right? There's
True.
nothing worth gambling your life for, lah. Life is we only get one life, lah. So we should always like now, lah, right? We are all staying safe. Okay, so Dr. Muya, in your opinion, why do people still go for unlicensed practitioners?
I think the most top reason, in my opinion, is because there is a total lack of awareness.
Okay.
I suspect that many does not even know that certain procedures can be harmful if it's not being done correctly, and many actually does not know that certain procedures can only be done by licensed doctors in a licensed establishment.
Okay.
And yeah, the reason of this lack awareness is probably because we, the licensed practitioners, as a medical doctors, we have limitations of advertisement. We are bounded by medical ethics, and we can't simply advertise like how a business should advertise. So this, however, become an advantage for irresponsible and unethical, non-qualified individuals to market themselves as a business opportunity to the gullible public, especially with their promotion cheapest, best in price, best in the market kind of thing. So
Yeah.
I think that's my opinion on why people
You're right.
still
You're right. I think price factor becomes something very very attractive, right? The price factor is always the main attractive reason. And then of course, with the limitation of a doctor, actual certified doctor, having the limitation of not being allowed to market. Gives them the advantage, so to speak, because they can blast out advertisements. How cheap is it? How fast? How easy? Whereas the unsuspecting public, without knowledge of knowing that they are an unlicensed practitioner, these are the people who fall prey. So general public education, of course, very 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 important. And then we are doing our best. I believe MSPRS is also doing some of your own projects to get the word out, to make sure that everyone is well educated, so they are well prepared. Well, the good thing, I guess, is in the world of technology today, information is at everyone's fingertips. And the press of a few buttons, also they can actually get the information that you need. So perhaps that is also working in favor of the MSPRS goals, right? Okay, I'm going to show a comment from one of our viewers, Nanim Sani. Plastic surgery usually, if the age kena redo back ke? Thinking how Korean artists maintaining their plastic surgery. I believe this is referring more to aesthetic. Maybe Dr. Marzida wants to answer.
Yeah, well, of course, age is an ongoing process. If, let's say, for example, you do liposuction and you think that you will stay that way after liposuction, you're happy with the result, and you don't think you will get your body like that for the rest of your life. No, you got to maintain. You got to maintain a healthy lifestyle. You got to exercise and whatnot. So to answer that, it's not a one-off surgery. It's a maintaining thing.
So even after completing your surgical procedure, your plastic surgery or reconstructive surgery, it is always important to maintain it, right? It's always important to maintain to stay in shape, basically, to stay in shape.
Definitely, because I mean, if you talk about liposuction alone, it's not an answer to weight loss, just body contouring.
Okay, I just want to roll back a little bit, since we are talking about liposuction again. Is liposuction or arm liposuction generally a safe procedure, or is it considered a high risk one?
Well, I believe I'm talking about this. Liposuction is an invasive procedure. So when we talk about something invasive, you must take things seriously. Okay? So, but overall, when you're asking generally, is it a safe procedure? The answer is yes. Provided that it is performed by somebody who is educated, well trained, knows what to do, experienced enough, and competent in evaluation and judgment in his or her surgical techniques. Definitely, it's generally safe. But of course, you will have some side effects and complications. Side effects are things that will go away after a certain period of time, like bruising, swelling, but you can get moderate to severe complications too, and of course complications that can lead to death.
Oh, wow.
Yeah,
Yeah, I guess, I mean, in Coco Siu's case, yes, that will be the worst
yeah,
case scenario.
exactly. So never take liposuction lightly. No matter how many people think it's a very light procedure, it is because it is invasive. Knowing the worst case scenario that can happen during liposuction, so you need to be careful.
Yeah, I think, I guess maybe generally people think of liposuction of, oh, just vacuum out the fat lah, senang je.
Well,
Okay,
that's not the case.
yeah. I mean, it's I guess the news, although a very unfortunate event, would probably wake a lot of people up lah in this case. So, again, condolences to the family.
Yes.
Things like this should never happen to anybody lah. Okay. Now moving on to the next question. Dr. Muya, you are from the government sector, and Dr. Mazida is from the private sector. Maybe can you help? If say I want to do a surgical procedure, how do I pick? Should I go to a government or a private sector? What are the pros and cons of each? Dr. Muya?
The surgical procedure can be done both, either in private or government sector. However, the government sector, we must know that we are using public money, and therefore we prioritize other cases such as cancer, cleft, and not just solely for beauty reason kind of surgery. Having said that, we do some cosmetic procedures because this is how we train. And also there are some cosmetic procedures that not only for beauty enhancement solely, but also to treat certain conditions and problems. The difference is that in government sector, we have a team-based approach most of the time. Although there is a doctor in charge of a patient, but generally there is a team of doctors, a team of consultants, specialists, medical officers, and also house officers that are involved in the care. In private, I suppose it is more personalized, right, Madam Mazida, and there are some other advantage from the private sector side that maybe Madam Mazida can elaborate more as she's from the private sector.
Okay, Dr. Mazida?
Well, yeah, like Dr. Muya mentioned, it is actually a personal choice where you want to go. But like correctly mentioned by Dr. Muya, cosmetic aesthetic surgery is not a priority in the public. So this is when the private sectors complement our national health and medical system. So yeah, but having said so, when you talk about having surgery in a private sector, not only who you go to is important, but where you go to is important as well. Because like I said, you must make sure that the private place that you go to is well equipped. Have a proper minor surgical room, minor daycare center. It's a good hospital, established one, which is accredited. And yeah, depending on how extensive or how invasive of a surgery that you desire and to undertake. So like again, it's all about teamwork. The more invasive, the likelihood that you are safer in a well-established hospital is works better. But like I said, cost. You mentioned just now cost. Cost is a very important determining factor. Well, it's undeniable, and that plastic surgery, cosmetic surgery is a very expensive and all. So, but sometimes it can be made more affordable through some, plastic surgery financings. Some surgeons, they do, like installment spaces, things like that. So you gotta speak to your plastic surgeons, and probably he or she will highlight to you more, right?
Okay, well, I did not know plastic surgery also can be paid by installments. Okay, that
Oh,
is interesting
it can.
information. Okay.
Also,
Okay, last but not least, what can the public do to expose unlicensed practitioners so that mishaps like this don't happen to anyone else? Dr. Muya?
first, public can make a report at Pusat Aduan of Ministry of Health. They can do it online. Also, they can also spread this information. I think this information are quite new for most of us. I mean, most of the public. Spread this information to your family members, to your friends over a cup of coffee or lunch or room. Since we are now in CMCO, it's a good topic to be discussed and chat with someone we care about. Education is the key to awareness, I think. And before you indulge yourself into any sort of treatment, especially the invasive ones, please do your own research. Please ask around. Like you said just now, information is really right on our fingertips.
Yes, it is. It is. It really is nowadays. Okay. I see. I don't see any other questions coming from our viewers. If anyone has any questions, this is the last chance to ask. Okay. So now, before we move on, sorry. I think we have already come to the end of our segment. I think we covered pretty much everything already. Yeah. So just to recap, the public needs to know the difference between unlicensed and licensed practitioners. There are probably some minor things which beauticians can do, but anything that's invasive, regardless of a little invasive or a lot invasive, everything requires a licensed practitioner. In order for you to know whether the center is licensed or not, you can always check online. You can check with the MSPRS. Can also check. Am I correct?
Yep, msprs.org.my.
Yes.
Instead.
Okay. And the other one would be the government's Ministry of Health. Is it Ministry of Health?
Ministry of Health to see the credential estheticians.
Yes. Is it from Ministry of Health?
Yes.
Okay, so these are the two places that you guys can go to get the information that you require to see if a practitioner is licensed or not. And then first speak to your licensed practitioners and then plan out the surgery so that you know what you're getting yourself into, you understand the risks and then make the right decisions. Okay, so I would like to thank you both for your time, Dr. Muya, Dr. Marzida. Before we end the session, there's one question here. Okay, let's bring up the question first. Okay, would you recommend a patient with some keloids to go for surgery after few steroid injection and not subsiding? Who wants to take this question? Dr. Muya, maybe?
Okay. So for keloids, when we're talking about a surgery for keloids, we have to understand that there's a very high risk of recurrence and it might be bigger than the previous one. So that is why we usually have some sort of injections, scar care, before we proceed with keloid surgery. And if we do a surgery for keloid, we do an intralesional excision, whereby we do completely remove the keloid, we just downsize it. Because we want to lessen the risk of the keloid getting bigger than the previous one.
Okay.
Question?
Yeah, she also follow up and say it's huge, painful, and bleed if injured.
Okay. This is considered like online consultations. I think for me to give an opinion for such a clinical scenario, this is an example that you can't get a management of treatment online. Why? Because a doctor needs to assess it clinically. We need to see and ask a more thorough history and do a more thorough clinical examination before we suggest or advise for any kind of treatment. But in general, I would say that the management of keloid is basically injections, and the surgery part we need to discuss based on the outcome of the injection.
Okay, so basically, surgery can be done, but there is a chance of recurring. Am I right?
Yeah, and we can't remove everything completely. Not downsizing. Okay, Darwin.
Excuse me. Okay, so yeah. Thanks for the answer. The commenter also, thank you. Okay, so now that we've reached the end of our segment, before we leave, is there anything that the Dr. Mazida or Dr. Buya wants to share? Perhaps anything to add on, or anything you can share about what MSPRS is doing currently?
Okay, we on behalf of society welcome you to approach us if you have any questions, any doubts pertaining the issue. We will try our best to explain and to guide you for to go to a licensed doctor and whatnot for any plastic surgeons near you. But what I want to add is just like I said before, there are two ends here. The giving end and the receiving end. So I think both parties must make sure that the giving end, they know their limit, and the receiving end, please do your homework and so that you are so that your safety comes first, basically.
Okay, Dr. Buya, anything to add?
I just want to add, Alvin, that our society is currently part of a joint committee called APAC, short for Aesthetic Public Awareness Campaign. So we collaborate with other organizations such as Pertubuhan Doktor Estetik Berdaftar Malaysia, and also Malaysia Society of Aesthetic Medicine for this. And with this joint committee, we hope that we will continue to strive for public education and their safety. And of course, on behalf of my society, you can follow our Facebook and Instagram page at msprs.org.my to know the latest updates pertaining to plastic reconstructive and aesthetic surgery. And in a nutshell, my take-home message to the audience and everyone here is that please do your own research and find out whether your doctor is credentialed and whether the place that you are going to get your treatment is a licensed medical service. Be safe, stay safe, and stay beautiful.
Okay, very good advice to everybody. I really thank you for your time for taking this 45 minutes or so to come online and share with everybody. Hopefully we get to educate some people and save some lives, so to speak. Okay. All right. Thank you very much, Dr. Mazida. Thank you very much, Dr. Muya.
Yeah,
Thanks
thank you for having us.
Yeah,
Okay.
thank you.
All right. Goodbye.
Bye.
Okay, there you have it, guys. That's what the experts have to say about it. I'd like to also thank you for tuning in. Do like and follow our UShop Facebook page so that you will be informed of the next installment of this Inside Coffee, where we speak to experts regarding trending matters. For now, that's all there is for today. My name is Elvin Lee, and thank you for joining us. So, goodbye.